So my name is Dr. Lodi. This is Dr. Jain. We both are internal medicine residents. We came from Marshfield Medical Center for this lecture, which is about back health as per se. So usually what I've heard is that there are people who ask plenty of questions as well, but I want to start with explaining what is back made of, what are the components, how a back pain can arise, and what things can you do to prevent the back pain from happening in the first place. All right. So first of all, back pain is a very common thing that we see in the clinic as well as in the hospital. More than like 80 to 85% of the cases of back pain that we see, they are mostly as a result of a back pain, what we call as a non-specific back pain. By non-specific, you mean mostly the pain is coming from the muscle. For example, if you had a muscle spasm, if you slept in a position which wasn't ideal, you can have back pain, and the next day people come and they go like, my back hurts, what it could be. But this does not mean that all the cases of back pain are because of muscle spasms. But those cases which might need imaging, such as X-rays, MRIs, or which might need immediate surgical procedures, they are rare cases. But it's important that you should know some of the conditions which those cases are associated with. And once you call the nurse's hotline, or if you go to the doctor, what specific things you should be answering to the doctor for him to analyze or triage you into understanding what you should be receiving at this point. First of all, you should be telling your doctor if this back pain, for example, if you come to me and you go like, I have this back pain for 3 days. Was there any event that led to this back pain? For example, did you sleep in a bed that wasn't your usual bed? Did you sleep in a couch? Did you fall? Also, if you're on any medications that kind of increases your risk of fractures. For example, steroids are well known to cause, to weak your bones in a way. So most of the patients who have, for example, rheumatoid arthritis and certain other conditions that need them to be on steroids, and they are at increased risk of fractures. If this back pain is associated with any fevers, or if you feel more hot than usual, or if there are any chills associated with this back pain, because this might help us in understanding that there might be an element of infection that might be causing this back pain, and not just a strain that we see in most of the people. If the patient themselves have any history of cancer, because certain cancers like prostate cancer in males, such as breast cancer, lung cancer, skin cancers like melanoma, they have tendency to, in the advanced stages, they can migrate to the bones as well. And the pain with those type of cancers is kind of different to the regular pain, back pain that people experience. So these are certain important things. Also, if you think that as soon as the back pain started, you're having changes in your bowel movements. For example, you're having a bowel movement when you don't want it to. If you're having urinary incontinence, or if you're unable to pee, because your back in a way is connected to everything. All the nerves which innervate your body, they kind of go through your spinal cord. So back in a way is made up of 4 main things. The bones that you feel, we call them vertebrae. Just imagine back as coins which are stacked on top of each other. Okay, and if we drill a hole in between those coins, there's a spinal cord that passes through it. And spinal cord is, in a simple words, I can say, it controls all the nervous system of your body. If you want to move your hands, if I touch someone on their hands and they feel something, it's because the information is relaying through the spinal cord and going through the brain to the brain. So those bones kind of enclose the spinal cord and protect it. So these would be the 2 components, the spinal cord and the bones. These bones in between them have cushions, what we call as discs. These discs, what they do is they decrease the friction, and they decrease for example, if you're jumping and all that pressure, it kind of like absorbs that pressure. The 3rd component is the disc. The 4th component are the muscles which are surrounding it. So in total, it would be the bones, the spinal cord, the muscles, and the discs. If you remember these 4 components, you can tell that back pain can arise from any of these components. The muscles, a person can have a back pain. For example, if a young guy comes to me and says, I was exercising in the gym, lifting some heavy weights, and all of a sudden I'm having this back pain. and I might suspect he's a young guy, less risk for fractures. This is it coming from the disc? Is it coming from the muscles? So muscles spasms can cause the back pain, which are most of the cases. If a person who is, for example, above 50, person is on steroids or medications that can weak bone, had a recent fall and came to me, I might suspect a fracture can cause this back pain. So the bones can fracture itself as well. If a person comes and goes like, I'm having numbness in my feet and I feel tingling in my hands all of a sudden and my back hurts. So I might suspect that there might be the disc might have herniated, that is compressing the spinal cord, that is causing all these symptoms. So you might experience your doctor asking plenty of questions like any bladder or bowel incontinence, any numbness, tingling, any fever, chills. That's only to narrow down what might be causing it. So we did discuss about the causes that can cause this back pain. What to tell your nurse? Did the pain start after any specific episode? Like you fell? Were you doing any like strenuous activity? That is very important. If the pain travels down to your thighs, because this might be an indication that a nervous component is involved, like spinal cord might get compressed because this is serious. If you're having any fever or chills, because sometimes what happens, people might have an infection of the blood or of the skin. That bug that is causing that infection can travel through the blood and go into the spine, where they can cause infection of the bone called osteomyelitis, or they can cause an abscess or a pus around the spinal cord, which is kind of which can over time decompensate, and the abscess can rupture. It can involve more part. So these things are important. This helps in triaging you, that whether you should go to the emergency department right away, you should see your doctor at any feasible time. So it kind of helps in understanding what kind of pain is it. How do you treat it? It mostly depends on the cause. If your pain is because of a muscle spasm, then the treatment is different. But if you're having symptoms that you can't move your legs, if you're having symptoms that all of a sudden you feel altered sensation in your hands and legs, then the treatment would be different. First of all, in that case, we would have to find out where is the pain coming from. So your doctor might want to do x-rays, MRIs to find out what's happening. If for example, I'm examining you and I feel that your muscle is spasm, and I touch your muscle and you go like, it hurts right at this point, and you were doing something and all of a sudden you have this back pain, then the treatment is different. Since these are most of the cases we see, I would want to go through very briefly about the treatment. And this is mostly the conservative treatment, which you can actually do at home as well. This can save you a visit to the doctor as well. But it's important to understand the features which might be serious. How we treat this non-specific back pain or a muscle spasm, which in most of the cases causes back pain, is, first of all, it's very important to stay active. It's a myth, and most of the people still believe that if you have back pain, you should rest, and you should just strict bed rest helps in this back pain. All the recent studies which have come out, they say that yes, you might have to rest for a day or two, but it's very important to start to get back on your feet and walk around, because over time activity helps. Warm compresses, they help a lot. They help in the muscle that has gone into that spasm. These warm compresses help in relaxing that muscle. If you want medications, you can use them. For example, you can use Tylenol, which kind of helps if you're having any fevers, if you're having any pain. Over-the-counter pain meds like Advil, Excedrin, they helps in inflammation as well. But it's important to talk to your doctor before using those medications, because they can increase the risk of bleeding, ulcers in your belly. Also, if you're on certain medications like Coumadin, blood thinners, which many people are, they can interact with that medication. But Tylenol, more or less, is considered safe. It can cause bad effects to your liver if taken on higher doses. But if a baseline, a healthy person, if it uses Tylenol every now and then, I would be okay with it. Massage actually helps in making sure that muscle that has gone into spasm, it relaxes. Physical therapy over time, because sometimes what happens if I'm using my back doing some exercise, it's possible that involuntary involuntarily my back is using certain muscles which are not supposed to be used, because the muscles which are supposed to be used, they are not very well built. So I'm using accessory muscles in doing that task. So physical therapy helps in building those muscles, the primary muscles which are actually supposed to do that task. So physical therapy kind of helps in a way if we are sure that your back pain is coming from a muscular etiology or because of spasms, because of certain activity that you do daily. Exercises, some people find yoga very helpful. Tai Chi, some people say it helps with their back pain. Anything that helps in strengthening your muscles. And stress reduction, because recent studies have shown that people who work in certain types of jobs which are very demanding, not because of physical stress, only because of psychological stress. One of the symptoms that they experience is back pain. So stress reduction techniques, and in a way, yoga, exercising, these things can help in reducing stress as well. These are all the things that can cause back pain in as simple language I can explain. How can you prevent it? One of the main things that we say to people around here is, for example, if you have to bend down to pick a certain object from the ground, most of the people, what we do is we go this. So don't do this because you'll be putting excessive pressure on your back. Try to bend your legs, go down, get straight up. This actually helps a lot. So we say use legs, not back. And just because sometimes I do that too, I'm lazy. So I bend my back instead of doing it. Staying active is very important. Make sure you're walking. If there's a certain exercise that you do, make sure you keep on doing it. And for example, if your job requires you to sit in a particular position for longer periods of time, make sure you take breaks every now and then, straighten your back up, try to walk around. Or if your job requires to stand in a certain position for longer times, make sure you do the opposite. So don't sit or don't stand at a specific position for longer intervals. This is what we do to prevent back pains from happening. But this is mostly for the muscular back pains.
First off, if you have any questions, you can go ahead and ask. No, otherwise, all right. So, my name is Dr. Jan. I'm an internal medicine resident, just like Dr. Lodi. Dr. Lodi did a great job at bringing your attention to like how back pain can be dealt with, what are the red symptoms that you should look for, and when should you try to get medical attention. And most of the times, if you have those red symptoms, red flag symptoms, you should try to seek medical attention as soon as possible. Most of us in lifetime have had back pain or will have back pain sooner than later. Like Dr. Lodi very beautifully explained what is composed of the back. Most of the pains occur either in the muscle or the bone, or the discs, which can very well, which are basically a cushion between two vertebrae, which can very well be dislodged and can cause nerve compressions and severe pain. Most back pains, as per statistics, more than 80% can be treated without medications, and most of them are preventable. The factors or the risk factors of having back pain is, first off, obesity. Having excessive body weight puts more pressure on your spine, puts you at high risk of injuring spine, put you at high risk of having a bad posture and excessive strain on the joints and the muscles of the back. Poor muscular tone of the back. In long run, your muscles around the back work as an internal brace around the back joints and keep them in place. Having poor strength or poor muscle tone is a big risk factor. Regular back exercises is a very, very good way to prevent back injury. Back is composed of vertebrae, which are essentially bones. Anything related to bone health would be very, very essential for a good long-term back health. Very often we see, especially in older females with leaner body composition, they tend to develop osteoporosis, which is very weak bone, or osteopenia, which is essentially not that weak bone, but still weaker than what they should be. Very commonly, we see compression fractures when the vertebra just collapses by itself because of weak bones. That is another very common thing we see in elderly population. How can you avoid having osteoporosis? It is a whole big topic, but long story short, good calcium intake, make sure you have some vitamin B supplementation. Sunshine is not that we can always find around central Wisconsin, but you have to have some supplementation. Your doctor should be screening you at the age of 65, especially being a female, for osteoporosis and treat it accordingly. Again, cannot emphasize enough, exercise has a role on retaining bone mineral density in long run. Whenever you have a direct pressure on your bone being a dynamic tissue, there's always some bone is being made and some bone is being broken at the same time. Whenever you put direct strain on the bone, it tends to retain more and more calcium. And hence improves your bone mineral density and strengthens your bone. At the same time, avoiding obesity, regular exercise, and some back focused exercise, especially weight-bearing exercises, would be a great intervention that you can do regardless of your age, regardless if you have back problems or not, for long-term better outcomes. Posture is a big deal. In current times, most of us spend enormous time over computer, including young adults and elderly. No matter what, everyone has computers in their lives, and we sit in a very bad posture, especially when we are trying to focus. Ergonomics is very important while you're working, making sure that your back is straight while you're sitting at your work, and you do not have excessive stress on your back. And moving around a little bit here and there usually helps avoiding any back injury. Dr. Lodi very well explained how you should keep your back straight and avoid any injury. Lifting a weight or anything heavy. It is more of a behavioral change that gets you better back outcomes rather than trying to get rid of the pain using short-term medications. In today's medicine, we have a tendency of going to the doctor and expecting to get a magic pill to fix all our problems, which not always is successful, but we have to put in a good investment, a lifetime investment of better health overall, exercise, and good habits of preventing your back injuries, and you might very well not have any major back issues as long as you're alive. Any questions by far? Yep, go for it.
Yeah. So, and actually they did a survey in it's an old survey in 2002, and they found out that somewhere between 40% of the Americans, they said that they have had back pain within the past week. So not a specific etiology of why, just back pain in general. So it's a very common thing. So it's very important to not assume the worst. Don't go like, oh, I have back pain, do I have cancer? Don't assume the worst. There are certain, just like Dr. Jain said, danger symptoms. If your age is above 50, if you're having unexplained weight loss, and you feel like your appetite is okay, you're eating fine, but why am I losing weight? Or if your appetite is getting decreased day by day and there is no specific reason of why it is decreasing. If you're having all of a sudden neurological symptoms like numbness, tingling, and if you can't control your bowels and bladder anymore, these are certain danger signs, and I would recommend you to seek medical attention straight away. If you're treating your pain after this lecture, for example, if anyone has pain and they go like, oh, I remember those two doctors came to the community center and they said 80% of the cases of back pain are because of muscle spasm. So I might have just a muscle spasm. So I'm going to treat my back according to the points that back pain with the points that they told me. After 1 month, the back pain is still there, and you feel like even like 2 weeks, you're using everything, but the back pain is non-responsive to any of the measures that you are doing. Seek medical attention. There could be something that's not a muscle spasm. If we say more than 80% are back pain, there is still 15 to 10% of the cases which are not, and they might need immediate attention. When you go to your doctor, like I said, he might ask you, what were you doing? How long the pain has been there? Where does it hurt? Does it go anywhere? Any fever? Any chills? So I know it's very difficult. If I'm in pain myself and I go to a doctor, oh, my back hurts, and the doctor spends like 20 minutes asking all these questions, I would be like, just treat my back pain. Don't ask me these stupid questions. But there's a reason why we ask, just to help you go down that path. Because we might give you some medication that would, just like Dr. Jain said, to help the pain. But if we don't know where is it coming from, as soon as the medication wears off, you're going to start having that back pain again. So our goal is, yes, to make the person comfortable from the back pain. But the greater goal is to find out where is the pain coming from. Just like fevers, we can't treat fevers. We can't give you cooling blankets. We can't load you up with Tylenol. We can't put you in a nice water. But if we don't know why is the fever happening, what's the point of treating that fever? So these are some things which we wanted to convey to you in as simple language as we can. It's common, but it can be serious. What are the certain things that you should be looking at by yourself and deciding, should I go to the doctor? If you do decide on going to the doctor, what specific questions you should expect? And if your doctor hasn't asked those questions, feel free to add to the history. If you get a certain diagnosis, understand, try asking questions. Every time we see people, we expect them to ask us questions. But honestly, in my experience, which hasn't been much, but still, I have experienced that people don't ask me much questions. If I would go to a doctor, I would say like, give me 10 minutes, I have a few questions about my health. Because it's very important. If a doctor says, I want to do an x-ray, you can be like, okay, so like, what's your plan of action here? Like, what do you expect on doing? What you're thinking about? I want to know, what are you doing with my health? So feel free to ask questions. It's your health. It's about you. And also what things you can do to avoid back pain happening in the first place. All right. It was a short, concise lecture. We are open to any questions. It's very brief. We'll try to come here again, choose a different topic, and explain that in full detail. All right.
Any questions for us?
Nathan?
Great. Thank you very
All
much
right,
for coming.
thank you.